Across Canada, an average of 30% of individuals report experiencing some form of child abuse, with British Columbia at a higher than average rate. And that is the number of those who have reported. The actual numbers are probably much higher. Many children who come forward experience a disjointed response from service providers, leading to system-induced trauma.
Meet Joe. Joe told their teacher someone hurt her. Joe is scared, and so is her teacher. They don't know what to do or who to call, so they take Joe to the principal's office. Joe thinks she's in trouble and has to tell her story again. The principal calls Joe's mom, and they go to the Ministry of Children and Family Development. Joe tells her story a third time to a social worker. Next, the social worker says they should talk to the police, so they go to the police station. Joe repeats her story. She then meets with a victim service worker who offers support, and Joe tells her story all over again. Then, she's referred to a counselor, and Joe has to tell her story for the 6th time. Each time Joe talks about what happened to her, it makes her feel afraid, overwhelmed, and anxious. But there is a better way.
Child and Youth Advocacy Centers, known as CYACs, are designed to provide a coordinated response for children and youth impacted by abuse and violence. Traditionally, this occurs in a CYAC building where specially trained police and social workers, along with victim service workers, make up multidisciplinary teams, or MDTs. This means the child doesn't have to travel to each of the services, and the environment at CYACs are child-friendly, with the interview occurring in a soft interview room. CYACs connect children, youth, and their families to services designed to meet their unique needs, assist them to navigate any system they may encounter, and reduce the number of times a child must tell their story. But many communities across Canada face barriers to having a CYAC building, such as lack of resources, low population density, wide geographic area, and difficult travel.
These are some of the challenges we faced in our West Kootenay boundary region. We are spread out over 30,000 square kilometers and have 80,000 people in our region, with over 16,000 children and youth. We wanted to find a collaborative approach that would meet the needs of children and youth within our unique region. Over 150 service providers discussed whether a CYAC would be feasible in our area. It was determined that a unique rural model would be the best fit for our specific needs. How has Sky implemented the aims of an urban CYAC in our rural region?
We have developed multidisciplinary teams consisting of victim services, police agencies, Ministry of Children and Family Development, and other relevant community services. Together, we created cooperation agreements that outline how we will share information and work together when a child or youth discloses abuse. We created child-friendly interview rooms so that kids feel comfortable when they have to tell their story. We provide advanced training to our forensic interviewers so they have the skills needed to interview kids, and we ensure that a recorded interview is done jointly between police and MCFD. We support healthcare professionals in each community to access training so that they feel comfortable supporting kids. This way, kids can receive examinations in their home communities instead of traveling far distances. So instead of kids having to go to multiple places to get the help that they need, the services come to the child. In fact, the needs of children and youth are central to everything Sky does.
Studies show that investigations conducted collaboratively and in supportive environments lead to an increase in charges laid, better quality of evidence, more guilty pleas, and higher conviction rates. More importantly, Sky helps children and youth by reducing the risk of system-induced trauma, helping children and their families feel less overwhelmed. Statistics show that often children who received a coordinated response require less long-term counseling. Working together makes for less work. It can make all the difference for a child. Reach out to your local Sky coordinator to learn how you can be a part of helping kids in your community.